ASIA Impairment Scale is a standardized neurological examination that describes a patient's functional impairment due to spinal cord injury. It was developed by the American Spinal Injury Association as a universal classification tool for spinal cord injuries based on standardized sensory and motor assessment. This scale indicates how much sensation an individual feels after light touch and pinprick at multiple body points and tests critical motions on both sides. The ASIA Impairment Scale, also known as AIS, classifies spinal cord injuries into 5 categories: A, B, C, D, and E. These categories are based on the severity of the injury and the extent of the probable neurological impairment. The 5 types are defined as follows. The ASIA Impairment Scale includes a physical exam, neurological evaluation, and other diagnostic tests such as imaging studies. Healthcare experts like neurologists, neurosurgeons, and rehabilitation specialists often use it in a clinical context to assess patients with possible or actual spinal cord injuries. The following circumstances call for the usage of the ASIA Impairment Scale: diagnosis, treatment planning, and monitoring progress. To use our free ASIA scale, follow these steps. Download our ASIA scale from the Carepatron platform, which you can find in the link in the description. The ASIA Impairment Scale, AIS, is a standardized system used to assess and classify the severity of spinal cord injuries. Firstly, identify the level of injury. The first step is to identify the level of injury, which refers to the lowest level of the spinal cord that has normal sensory and motor function. Next, test motor function. Then, by assessing the strength and movement of essential muscles in each limb, the doctor will test the patient's motor function below the level of injury. The patient will be asked to make a series of motions, and the doctor will grade them on a scale from 0 to 5. Next, test sensory function. Clinicians will also examine the patient's sensory function below the level of injury by assessing their ability to perceive, touch, pinprick, and other stimuli. Next, test reflexes. By inducing reflexes like knee-jerk reflexes, the physician can evaluate the patient's reflexes below the level of injury. Next, determine the ASIA grade. The clinician will establish the patient's ASIA grade based on the motor function, sensory function, and reflex scores. The 5 possible grades are A, B, C, D, and E. Lastly, interpret the results. The ASIA grade offers essential information regarding the severity of patient's injury and the likelihood of recovery. Patients with higher ASIA grades, D or E, typically experience better results and have better chance of regaining their functional abilities than patients with lower grades. Here is a sample of our ASIA scale, which you can find on our Carepatron platform. To find our ASIA scale, go to our Carepatron platform or click on the link in the description. In our template section, we have a variety of templates and worksheets for you to use with your patients. You can filter or type in the keywords to find the worksheet. Thank you for watching our video at Carepatron. If you enjoyed this video, give us a like. If you would like to see more videos like these, subscribe to our Carepatron channel or click on one of our recommended videos.